Hello and welcome to this week's What Were They Thinking? Amongst this week's news items we see updates to the FDA scandal regarding the Alzheimer's drug, the increasing evidence that there may be non-medical or non-surgical means of dealing with endometriosis lesion development, controversial research into what are considered zero-calorie sweeteners, a New York alligator nearly came to an unfortunate end due to cold shock, mushrooms might greatly improve brain cell development, or at least in a petri dish. The US has approved the planting of genetically modified trees that specialize in storing carbon. Further information about the discovery of matter in the Ryugu samples, and how lightning could play a very major role in how Mars cycles through chlorine. The timestamps for these articles and others can be found in the description box below. To start with an update on last week's news, specifically how the FDA was experiencing a lot of criticism, especially from a congressional meeting on them, about how they had approved an Alzheimer's drug called Adulhelm. This drug had been approved with many questionable actions around it, especially where the FDA is concerned. The result of that debacle is that the primary FDA official behind its handling has now stepped down. It's been described as having an inappropriately close relationship with the drug maker, which is an interesting way to describe this situation. Most people have called it a conflict of interest or outright bias, but sure. Unfortunately, what we're seeing was not a new development only as the drug was being approved by the FDA. Rather, it appears to have at least started 2 years prior to the FDA approval process, in which the staff member of the FDA in question met with the head scientist of Biogen, the company responsible for this new drug. This led to a disquietingly close collaboration between Biogen and the FDA, where it appears that the FDA and Biogen were literally writing documents for each other. This sort of fiasco is not something the FDA really wants right now. Under normal circumstances it would be embarrassing and awkward, but in recent years they've come under fire for a range of other problems, let's say, whether that is baby formula, vaping products, some of the controversy around vaccinations, whether justified or not, issues to do with other drugs that have been approved. The list could go on. In other pharmaceutical news, Eli Lilly, one of the largest pharmaceutical companies in the world, has agreed to cut the cost of insulin by 70%. This is beneficial in several ways. Not only does it now make insulin that much more affordable, but it's also going to put pressure on other companies to decrease the cost of their insulin products as well. This is great news, and it cannot be understated how beneficial it really is. It takes the price from somewhere around $300 in a good situation, if not more than that, to somewhere below $40 in most cases. That is a huge benefit, and given the rate of inflation at present, it's unable to be stated just how good that would be. The idea is that even if other companies choose not to lower their insulin prices, there is a good chance that there will be a large movement of people who need insulin from those companies who will then start using Eli Lilly's Humalog. This means that there is a market pressure now for these companies to reduce their cost too. Given the current cost of insulin, whether it's hundreds and hundreds of dollars, or relatively cheap in countries other than America that have a civilized medical system, the reality is a lot of people are having to ration their insulin. This decrease in price means that they may not need to do that anymore, and that reduces their risk of adverse health events. It is worth us noting that the decision may not be entirely, let's say, philanthropic. It is possible that Eli Lilly may be responding to the Inflation Reduction Act. This did bring in effect, a cap on insulin prices for those who are on Medicare. If they were on Medicare, the price for insulin for those individuals was capped at $35 per month. This means that Eli Lilly may have been forced to lower the price for those individuals anyway. If you weren't on Medicare, you would be paying $300 a month. And so this does raise some questions around the exact motives that they have for their decision, but it does not at all undermine what the results will be. The other possible reason, and not necessarily separate from the government decision, is that reducing the cost of insulin may not actually affect Eli Lilly's profit margins. Rather, it may have an effect on the profit margins generated by insurers in America. And so this is one of those things that, whilst at present the exact relationship for the decision-making process isn't known, and given the nature of the company may never be known, we can point out that it is apparently in effect and is something that will play out the way we would hope. Less pharmaceutically oriented, but still medically relevant, is a possible way that doesn't involve surgery for treating endometriosis. Understand, we say treating, not curing, and this is an important thing to be aware of. Endometriosis is the development of endometrial tissue in places other than the uterus, which is obviously not particularly good. Anything growing where it shouldn't be is bad. The problem is that, unfortunately, that endometrial tissue undergoes the same uterine cycle as what the uterus does. This means those parts of the body also undergo death and destruction each month as it's shed, but with very little means of disposing of it, unlike the regular menstrual cycle. The new treatment uses antibodies, and that appears to be able to target the growths or lesions in parts of the body where they shouldn't be. It is important to be aware that this is an animal model study, so we are a long way away from this possibly being used in humans, but it has shown great effect for what it is. The way this therapy works is that they have an antibody. The antibody will specifically target a molecule called interleukin 8. This is one of the molecules involved in inflammation, and closely related to endometriosis. By having the antibody block interleukin 8, you are able to prevent much of the inflammation and other issues associated with the development of endometriosis. The secondary benefit to this is that the treatment is not a once and done thing. Rather, it is a monthly treatment, so you don't need to worry about having to have daily injections like you would with insulin, nor do you need to worry about having to go into a doctor each week. Rather, it can be administered possibly by the individual, although more likely in a clinical setting, once a month, given the nature of antibodies and the storage issues associated with that. The test was conducted over 6 months at different doses. Both doses had the desired effect. It is, however, worth noting that although both doses were effective, it does appear that the results were unexpected, primarily because they were better than was expected. The reality is that this antibody-based therapy could be used in lieu of very invasive, very damaging, and theoretically not a cure surgery. Rather, it would greatly reduce the effects of the tissue growing, and would therefore provide, if not a cure, at least substantially longer periods between the possible need for surgery. And if surgery is effective, possibly a way to further reduce the size of the growth afterwards. The same sort of approach taken with surgical removal of a tumour, followed by chemotherapy or radiation therapy. It is worth us reiterating that this is a very early piece of research, and the pathway from here, where they've used an ape model, and they've had to transplant tissue, to get to a human treatment with this is an uncertain and very perilous path. The reality is, most treatments that go into clinical pipelines don't get to the end. There is a less than 1 in 100 chance of anything in clinical trials, let alone treatments that are not at the clinical trial stage, where the odds are even worse. This is why the next news is at least somewhat more encouraging. It is the treatment that has allowed stroke survivors to move their outer limbs, and specifically their hands, after treatment. One of the issues with stroke, depending on where it occurs in the brain, is that you can lose bodily function, whether that is sense or motor function. It can even be things like the ability to speak. All of these can happen, and there is no treatment for them, or at least there hasn't been until now. And this is a very early trial again, so be very cautious with how much optimism you have as a result. The way this works is that the research and consequential clinical trial has innovated the neurons in the spine to try and motivate them. This is done through stimulation, and this is direct electrical stimulation of the neurons. This allows them to more easily transmit the signal along the length of the body to the outer limbs. This has allowed the individuals in question to be able to have much greater motor control. This has also allowed them to improve their grip strength, arm movement, and dexterity, and it is practically instantaneous. The implant is not a small matter though. It is an implanted device, and it's basically two relatively thin wires that go into the top part of the spinal cord and then goes all the way down to the arm and hand. The way it works is to pulse out electricity, and when this pulse goes out, it allows the muscles to move, or more accurately, forces them to move. That's because the pulse amplifies the message in the neurons. Where previously the stroke caused those signals to be weak and underpowered, this increases that by amplifying it. The other upside to the study as it is now is that the two individuals who received these implants were not exposed to the same kind of stroke. This means that it may be a treatment for multiple different kinds of injury sustained from stroke. It is, however, not a permanent solution, and that is for a simple reason. The benefits wear off after about a month. That means once the implant is no longer present, the gains disappear. Gradually disappear, but disappear nonetheless. That means it would need to be a permanent implant for long-term therapeutical purposes. The research does, however, end with what is effectively the catch cry of all research: more research is required, please fund us. Or at least they say the first part. And that is simply because the study only had 2 individuals involved. It's not enough to find significance and possibly extrapolate meaning elsewhere. Further neurological news has been able to witness, for lack of a better word, the point at which Alzheimer's begins to take its effect, and that is when a protein in the brain goes from being at least what it's supposed to be, if not a disaster but at least functional, into a tangled mess that simply won't do anything at all. It's like watching a Hollywood starlet crash and burn. Except in this case, it's in your brain, and it's protein. Alzheimer's is typically identifiable because of the tau proteins that are developed. The tau proteins become mutated or otherwise tangled, and this creates the abnormalities. These abnormalities then cause neurons to stop functioning. The lack of function of neurons leads to neurological dysfunction and then cognitive decline. The process is kind of cool in a way. What they've done is apply less than a single volt of electricity to the tau bundle. This caused them to begin folding in the way they were not meant to. By itself, this is not so important, but what is important with it is that it allowed them to figure out the point at which the tau bundle passes from being functional to pathological. 1 volt is a fairly large charge within the brain anyway. Most neurons don't really fluctuate beyond 0.1 of a volt, either above or below the 0 threshold. You're really only going to 0.03 or as low as 0.07 of a volt. That's the difference needed for a neuron to fire. At the same time, however, there are a great many neurons in the area around where these tau bundles would be. This may eventually lead into one of the possible ways that the pathology of Alzheimer's develops. But as the researchers found, what you need is a very specific kind of tau protein called K18, which contains a very specific amino acid sequence within it. This amino acid sequence, which is a core peptide as it's described, is what, after hours if not days of being exposed to this voltage, changes, and changes irreversibly. That may be exactly what is the key to figuring out how to prevent Alzheimer's, by knowing what to target and how to target it to prevent the development of the disease in the first place, rather than having to cure it once it's happened. Sometimes, though, you simply can't prevent a disease. There are some diseases for which we have no way of stopping it in terms of actually preventing the disease from happening. There are ways to reduce the possibility of infection, for example with HIV, wearing condoms or otherwise having protected sex. But once you are infected, there is no treatment that will prevent it from progressing. It will just slow it down drastically. That is until the last 10 years or so. In the last 10 years, there have been a number of cases of individuals who have been cured, but understand, you could count these individuals on a single hand and still have fingers left over. That's why it's important when these case studies happen to talk about them. In 2008, you had the person called the Dusseldorf patient who was put on an antiretroviral treatment and then they had leukemia. Leukemia led to them having a bone marrow transplant, which completely eradicated their immune system. In doing so, their body was then cured of HIV because it was literally wiped from their body along with their bone marrow, and they were given new bone marrow. The most recent example has followed the same basic premise. It is worth saying that although we have described this as a cure, it's rather hard to say that anybody has actually been cured of HIV. The reason is very simple. It is a very nasty and insidious virus, and it is very good at hiding. This is one reason why the human immune system struggles to get rid of it, and in fact can't get rid of it. As a result, it is very often the case that although someone may not have any symptoms, they may still be infected with HIV, and this is why they remain on medication to basically prevent the virus from replicating and possibly infecting someone else or progressing into full-blown AIDS. There are some new drugs that are currently being explored for the ability to basically force HIV out, and that would help in dealing with it, and there are some genetic mutations that make someone resistant to HIV. But overall, there is no actual cure at present. It's simply that these individuals at present appear to be cured of HIV. And yes, most of them have been cured for several years so far, so it would be a strong hope that they are at least completely clear of HIV. On the other side of that equation is that the treatment used for them is extremely radical, and it isn't always successful. And not just unsuccessful as so far as it eradicates HIV, we mean not successful as in the individual receiving the bone marrow dies because of immunoincompatibility. So this is not a treatment at present, but it is certainly a interesting development that may guide future research. Next is the unfortunate study which has been published linking a 0-calorie sweetener to increased cardiovascular risk. The sweetener is called erythritol. It's used for purposes like stevia or similar, where you don't want to have an actual digestible sugar being used, but you want to add the sweetness to food, drink, and so on. This is not a bad thing to have, as increased sugar intake is one of the risk factors for things like cardiovascular disease. But then again, it's also closely associated with things like diabetes and obesity, which by themselves are risk factors for cardiovascular disease. So it's a question of which one comes first. The study itself is, to be quite blunt about it, not great. It's not a good study. It is at least some sort of information, but ultimately, no, there's no nice way to do this. It's a crap study. You really shouldn't be relying on it. The reality is, the design, the methods, the actual participant numbers, everything is kind of crap. One of the most immediate and obvious issues is that they took human plasma with platelets in it. They then took erythritol and added it to the plasma, and then tried to figure out whether or not it causes clotting. Generally speaking, that's not how it's going to get into the bloodstream. you're going to have multiple levels of metabolism before it gets there. Obviously, you have what happens in the mouth with saliva and the enzymes within. Then you have the stomach and acid, small intestine with various enzymes, and so on that then help to break it down further into the bloodstream and then the liver. All of this is fairly quick and fairly clear-cut. It's only after that you really have long enough exposure times where you have to worry about the possibility of interaction between erythritol and platelets. As we have said before, anything in a test tube, and that's exactly what this study does, can, at the right concentration, have an effect. The comic as shown points this out that in a petri dish, bullets can kill something. You don't need to be able to do it this way. There are perfectly good ways of looking at this using humans in the study or animals. Either way, that would be a much better kind of examination than what they did so far. And that's when this study becomes truly frustrating. They did use an animal model with mice, but the problem is, the animal model they were using with mice involved, by its very design, damage to the vascular system that would cause thrombus or blood clots to occur. Its design is fundamentally flawed. Could the research be valid? Yes. Is the research valid? It's very hard to say based on the method and results that they've provided. As it stands, it's truly just a frustrating read. It's poorly designed, poorly executed, and doesn't really work the way it's intended to. However, you may or may not wish to go and read the article yourself. Going from ridiculous and stupid news items to what is honestly just something of a case of toilet humour. What is possibly the oldest phallic object that humans have made to use as a dildo. Yeah, we went there. It is a carved toy made from wood, and it was found in a Roman fort. The fort is already rather famous for its plethora of phallic graffiti, let's say, but the actual object itself is somewhat unexpected. The object was found on a fort along Hadrian's Wall, so we're not going to be making any biggest dickest jokes as it's the wrong time frame. The object isn't a new discovery though. It was originally found in 1992, and at the time attributed as a darning tool. Now it is entirely possible that either the original researchers were correct in their interpretation of what the object is, and that the current researchers just have very, very filthy minds, or it's that the original researchers were much more innocent and sheltered than the current researchers are. Going from ancient sexual practices to modern sexual practices, but specifically the naked mole rat, and why its fertility is, well, surprising and confusing. The naked mole rat is a blind creature which should in theory have almost no chance of survival, let alone reproduction. Yet it's been surprisingly effective at getting by. Part of the survival mechanism for them is they live in colonies and that there is a queen. However, unlike every other mammal which has decreasing fertility as it ages, the mole rat doesn't. It will continue to reproduce throughout its entire life. Scientists think that at least part of this is that the average naked mole rat has 1.5 million egg cells across their ovaries. That's nearly 100 times more than a rodent in the form of a mouse would have at the same time. Not only do they have nearly 100 times as many, but they increase day by day from when they're born. This means they continuously get more. Contrasting this to a human will hit a peak in early puberty and then from thereafter it will decline. And largely that puberty matter is only because that's when they start being activated and being told to mature through hormones. Given the length of time for which a mole rat can live, the fertility that they show, and the overall bizarreness of their species, they could produce up to 2,000 offspring from a single queen. Going from weird animal news that's a little disconcerting to Surprising animal news, but not necessarily disconcerting unless you were to encounter this alligator yourself. The 4-foot or 1.2 meter long alligator was found in New York, experiencing cold shock. Yeah. The speculated idea at present for its discovery is that the alligator was owned by somebody who lived considerably further away in a much warmer location. For some reason, they've moved to New York, and then they've released the alligator into an area where no alligator would naturally occur unless you go deep into New York sewers. This is likely a perfect example of why pet ownership should not be a right, but a privilege. The next environmental news we have for you focuses on fungi, specifically research into how fungi would be the food of choice if there was a massive environmental disaster. For example, an asteroid plummeting onto Earth and killing just about anything and everything, either through debris or changes to the atmosphere. The gist of it is that because just about every kind of natural disaster that would have that kind of global impact is likely to result in substantial changes to the atmosphere, and that these in turn would, for example, prevent a lot of the sunlight penetrating to Earth, you would see that very few species that we currently rely on for food would remain viable. The only real exception would be mushrooms. The research in question is built on in a published book, and you'll find more information on this from Business Insider. Further to being the possible solution to the end of the world for humans and the only viable food source, mushrooms may also have a role to play in cell-based research, and specifically neuron and brain-specific leukocyte research. The lion's mane mushroom may be able to produce necessary signals to encourage the growth of things like neurons. Whilst yes, mushrooms have been used in various traditional, herbal, and alternative medicine remedies for forever, it doesn't necessarily mean that they have any benefit, and certainly not when consumed as a food, or in the case of things like traditional medicine, a quasi-medicine. In this case, what the researchers did was that they isolated a compound called N-D-phenylethyl isoheracerin, and the hydrophobic derivative that it's equivalent, heracerin A, and they then used this in a diluted format on neurons from rats. The effect was that it increased neurotropic, or the neuron development effect. By itself, that doesn't really help very much, but what they were able to do was quantify the results, and what they found is that the axons, or the long part of the neuron that carries the impulse, was twice as long, and that there were more than 3 times as many neurites, or the projections from the neuron, that eventually become axons and dendrites. The researchers did try using this in an animal model to see if it affected the rodents as well, and they do claim that it improved memory, but also they used a very dilute extract, about a 1:50 extract. It is worth us pointing out though that this element of the research is much more questionable, as they used a crude extract. Crude meaning that they did not refine the specific compounds that they used in the neuron research. There are also some questions about the research with regards to funding, as it does appear that at least some of the money for this did come from a company that specializes in this kind of product line. Going from weird mushroom news to somewhat more positive GM news, and that there's been an approval for the bollworm-resistant genetically modified cotton in India. This is not necessarily useful news, as it seems most Indian farmers have simply decided that they're going to ignore most of India's rules when it comes to growing genetically modified crops, as they've accepted that the benefits far outweigh any possible risk or fine for that matter. There have been a large number of genetically modified crops at least approved for preliminary field trials, if not outright approved in India, over the last few months. And this is just one more that adds to it. The benefits of this are that, well, you get more cotton, per an acre of land, and cotton can be an extremely useful crop to get cash. This is then used to be able to buy things like fertilizers and similar, or even genetically modified seed if need be, to then grow a food crop afterwards. The whole idea of this genetic modification is very specific. It targets the pink bollworm larvae. The larvae feeds on the seeds and fibers within the cotton boll, or the bit of the cotton that you actually want. By taking the Cry2AI gene from the bacterium Bacillus thuringiensis, you create a protein that is toxic to the pink bollworm, thereby protecting the cotton from this pest species and improving yields. At present, the field trial really only has one major job, and that's to be able to figure out whether or not it does provide protection, is there an improvement in yield, and does it remain safe, particularly with regards to things like mice and rabbits. You also then will have to look at carry-on effects of growing this crop that's been genetically modified, and that's going to be things like microorganisms in the soil. Is there a change in plant wildlife, and are there any other unrelated and undesired effects? Given current research into this, it seems unlikely that that would be the case. Going from India to the USA and the growth of another genetically modified plant, but this time specifically a tree. The idea is to start this plantation that's going to take the poplar tree that's been genetically modified and plant them out to try and soak up CO2. And we don't just mean soak up like a sponge. The tree has been modified to grow wood at a very high rate, and in order to do that, it takes CO2 from the air and turns it into the wood. The research relies on a fairly simple premise. Photosynthesis is not exactly efficient. One of the big problems is that it generates a lot of waste products from metabolism that aren't desirable for the plant and can often be quite hazardous. By turning these hazardous or toxic materials into more usable material, the initial research into this area found a way that they could increase growth by 40%. Now, nearly 40% increase in growth of a tree over a single year means that wood could become a much more environmentally conscientious way of growing building materials and similar. That research was basically public research though. The trick with this has been that their particularly modified popular trees are growing 50% faster, and this is only based on greenhouse research, so the real-world field trials will tell us how accurate that figure actually is. There is a good reason why they've chosen poplar though, and poplar trees are relatively slow growing. In reality, a landowner who is growing that as a crop, so to speak, would only get maybe one harvest in their lifetime. That's once every 60 to 90 years. The researchers have modified that where they can bring it down to once every 60 years, and now they're bringing it down to once every 30 years or thereabouts. So this is going to be a much more efficient way of growing these trees. The downside, or at least according to some, is that the work has not been peer-reviewed, the results are only from greenhouse trials, and that they're claiming that the federal government allowed them to jump a lot of the normal hurdles needed for this kind of thing, which does seem rather ridiculous. But then again, the very first news article for this video was all about how the FDA did exactly that. Next we go to technology news, and more specifically, legal news on technology and the social media companies and similar that host content. Presently, there is a court case before the Supreme Court of the United States of America, and it's looking at a range of things, one of which is Section 230, or as it's otherwise known, the Copyright Safe Harbor provision. The way Section 230 works is that those who host content but don't moderate it are not liable for what goes on their platform. If you do, however, start to edit or moderate what you are allowing to go on your platform, you are then responsible for what you've allowed to stay and what you've taken off. This means that theoretically, a host of content, when they are moderating something, could be sued for libel or similar. If they're not moderating what goes up, they are completely protected, but the individual or company that has uploaded content is liable to be sued. The lawsuit all stems from one individual who is trying to hold Google to account for the way they were attacked, more specifically shot, by an extremist in 2015. Their argument is that Google, through YouTube, allowed this to happen because they were recommending videos that promoted such extremist views, activities, and actions. This is where Section 230 becomes something of a problem. Strictly speaking, it's meant to protect companies from content that's been uploaded if they don't involve themselves in what's happening. However, by virtue of the fact that YouTube is recommending content, they have put themselves in the process. And therefore the question is, has YouTube, and as a result Google, begun editing what they're doing or otherwise moderating content? And that's where this court case is going to get very interesting and very complex. This is not the first time Section 230 has been the center of controversy. Past presidents have had issues with it. There are problems around how it's been implemented on platforms like YouTube, particularly, how Facebook has been using it, and in part even, it had a role to play in the Trump and Legacy Media lawsuit about how he was blocking, let's say, authors, to be generous, while president, and thereby preventing them from engaging in the political process. There are also other examples that are much more difficult, but overall there's been a lot of umming and hahing about how exactly it's going to be dealt with, as it's not a simple issue. Next we have space news, and specifically, at least staying on Earth for now, how Ryugu, the asteroid that Japan decided to bomb to be able to get samples of, has found to be containing far more and far more extensive kinds of biological material than was originally thought. The samples came back to Earth about 2 years ago now. They had to get back here in a very, very carefully contained capsule. Otherwise they get contaminated either on entry to Earth, or at least by virtue of them landing on Earth. The small 5 gram, or just under 1/5 of an ounce of material that got back to Earth contained a great many different materials, from carboxylic acids, amines, aromatic hydrocarbons, and more. Amines are what will eventually build up to amino acids. Carboxylic acids are also useful in the development of proteins, but they also have a role to play in development of RNA and DNA. Your heterodimers, like your heterocycles, are also extremely useful in creation of organic compounds. There are many different things that could be derived from this, and they were found in what is pretty much a ball of rock floating around in the void of space. Further, it's currently estimated that at least some of this organic matter would have predated the development of our own solar system's sun, Sol. This means they would have occurred in extremely cold conditions where we would not have had the energy to force chemical reactions in the direction that you might expect. Therefore, these samples didn't need that, and it does further support the current theory from physicists that it's possible to create very early precursor molecules for life in a very, very unexcited environment. You don't need miraculous creation or spontaneous occurrence of life. You simply need good old-fashioned chemistry. Going further into space, we have Russia's intention to go to the ISS and rescue it, so to speak. Rescue might be an overstatement. There are 3 astronauts who are currently from Russia on the ISS. The challenge for these individuals is that they can't get back to Earth at the moment. The only way they could return to Earth would be to go to somewhere like America, and America is not exactly welcoming of Russians at the moment. This is why Russia is trying to get another vehicle into space to try and get them back to, well, Russia. The problem Russia has had is that the original vehicle that was there to get the Russian cosmonauts back home, and then a second vehicle sent to resupply the ISS, have both been leaking coolant. And coolant in this case is a nice way of saying something very flammable and explosive. As such, nobody's very comfortable in sending a third vehicle up there to try and get the cosmonauts back. However, they are waiting to see about the final investigations into the current proposed unit to send and ensure it has no damage or other issues. The final article we have for you this week is all about Mars, and it takes us as far away from Earth as we're going to get, while also, surprisingly, sticking very much to what happens on Earth. The role of lightning, and, in the case of Mars, how lightning could play a role in the chlorine cycle. Mars really doesn't have any free-moving water, unlike Earth, so you're not likely to see something like rain clouds. What you get instead are dust storms, and they are very much like what you would see on Earth, and just as hazardous, if not more so. They do create static, and static gives rise to electricity, and the electricity gets released, and suddenly you have lightning bolts. This is not somewhere you want to be if you can avoid it, which is probably why we send the rovers there without a way to get back home. Now that the rovers are stuck there, they've been able to witness the beginning and process of one of the regular events on Mars. The storms that get so large that they cover the entire planet and last up to 2 months. These occur roughly every 5.5 years. Where rain clouds and to a certain extent storms play a role in cycling water on Earth, the storms on Mars could have a role in cycling chlorine, and in this case by breaking down chlorine salts and creating both chlorine in the atmosphere, but a range of other compounds, chlorates, perchlorates, and carbonates. These are useful in moving around the various elements, and so it's useful in turn for ensuring that there's a constant, if not great, baseline level of activity. The research indicates that not only is what they're able to observe of Mars's activities, but the chemistry and process behind it can also be replicated on Earth, is a perfectly valid theory and model. Unfortunately, the most recent attempt to be able to actually test this on Mars itself crashed, quite literally. The lander trying to take the Schiaparelli did not get there in one piece, crashing into the surface of Mars in 2016. That's all the news we have for you this week. Thank you for watching. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you have below.